So what I am talking to you about today is a project, an output from the Beyond the Form project. So this is a project that's a collaboration between CTIQ and the BCCC Alliance, and it's very pertinent to this group because it's talking about how ethics review bodies can think usefully about right-sizing their approach to reviewing communication between research teams and research participants. So to give you a bit of background about the project as a whole first, so we've been working for the last 2 years on this project with this awesome team of people here. I can see Brian is on the agenda for later this afternoon, and he's one of our consumer representatives. And this is a project that's looking specifically at how we communicate with research participants after the consent and recruitment process. So we're looking at how researchers currently approach communication with their research participants and wanted to understand what the opportunities and barriers were to adopting new approaches. So we were working towards developing some really high value, but also achievable recommendations, one of which is what I'm talking about today. So we looked at what's already been published in this space, and particularly we looked for projects where they had evaluated the approaches that they had taken. And we found that there isn't a lot of work in evaluating this part of the research communication. So during the project and at the end of the project, we also did a series of interviews with staff around Australia about their current experiences and approaches. So that's both participant-facing staff and staff who work at a site management level or the people who are developing the protocols as well. We also ran a series of participant workshops. So that's workshops with people who have been part of clinical research to understand what their experiences and preferences were. The final part of the project is still ongoing, which is a pilot project, which we're working with the Walter and Eliza Hall Institute, and they are incorporating some of the recommendations from this project into one of their clinical trials and evaluating the benefits and costs involved in rolling out those approaches. So all of the knowledge from this is going towards developing a toolkit, which we're hoping to launch early next year. So to look really quickly at the overall findings from the project so far, I'm not going to go into the slide in a lot of detail, but some of the things that we heard from participants is that they do want to hear more about what's happening in the research project as a whole, but they also want a variety of different ways that they might hear about that from. People are different. There are different things that they want to know and different ways that they want to know that information. They also really wanted the information to be clear and easy for them to understand. And they wanted researchers to follow through with commitments that they had made. So if they had said that they would receive the results, their individual results, or updates about the project, or updates about what the outcomes of the research project was as a whole, they wanted them to be able to follow through and deliver those pieces of communication. In our interviews with research staff, we heard, I loved the phrase that the previous presenter used about a love project. Like, a lot of people are doing really good work in this space, but sometimes it isn't work that is fully incorporated into the protocols, and sometimes it's not funded. So there definitely are great ways that people are communicating and prioritizing this work, but it could be treated in a more systematic way. So to talk about the toolkit, a major recommendation that we have is that research teams have a plan for how they're going to do this communication. The toolkit has lots of advice about different things that you might consider and different types of approaches to communication. One of the other things that came up a lot was a bit of uncertainty about what needed to be approved by the ethics committee and what other approvals might be needed to be in place. And there were definitely people saying that they weren't doing this work because they weren't sure about how to get it approved. So the team went back to the guiding statements. So the national statement has a lot of information about how, about the review of recruitment materials and consent materials. It also has some great guidance about developing ethically defensible plans for either sharing or not sharing individual results. And it encourages sharing lay summaries of the research outcomes. And it also has some great information about what to consider when you're developing your communication. So different aspects of participant situations which might impact how you present your materials. The National Clinical Trials Governance Framework is also got some great information about making information accessible for participants and recognising that there might be a diversity of mechanisms that might be needed for your participant group. But there's a bit of a mismatch here between what these statements say and what the people's experience were. So as a team, we decided to develop a communication piece that was trying to outline how we can go about working better here. So the aim of this was really around trying to come up with a plan that right sizes the ethical review. So there are some pieces, some types of communication that probably don't need as much attention, and there are some pieces of communication that probably need more attention. So trying to think through how researchers can best present their communication materials to the review panel and how ethics review bodies can focus their attention. So I'm just going to walk through this in, I can't actually see the time, but so we've got 3 sections to this document. The first is some background. So it goes through the requirements in the guiding documents, so the national statement and the governance framework, but also ICHGCP's recommendations, and also highlighting that if it's a CTA or CTM trial, so one that involves unapproved therapeutic goods, that the TGA's advertising code applies. And there's a whole bunch of other things that go into that. It talks about the importance of including consumers and developing and updating your plans. The consumers are the other side of the conversation, so it's really important that they are involved in developing the materials and the language that you're going to be using through the project. And also recognising that the world is changing as far as things like the use of artificial intelligence and social media is really changing the way that we communicate with each other. So we need to change the way that we think about how we review those communications. The next part of the document talks about specific types of communications that you might be including in your plan. I'm not going to go through these in a lot of detail here, but just to sort of point out that there are some things that are things that you can plan for, and it's a matter of setting up the right kinds of systems. There are some things that it's really useful to have a template where you can talk about what's going to be included in the piece of communication. So the content, the format, the language that's going to be used. You might have some information about the timing. For things like individual results, you definitely want to be talking about what kind of support or interpretation might be scaffolded around any documents that you send out. The summary of research outcomes is also an interesting one because the timing of that is often quite difficult to actually get that out to participants. If the site has closed, then it's unclear who is going to have the responsibility to take that document through the review process and make sure that it gets out to research participants. So as far as the ethics review process, we've also put together a checklist to try and guide ethics review bodies in how they might approach reviewing these kind of communication materials. And the first thing really high up on the list is, have they worked with site staff and consumer representatives to develop this communication plan? So this is really key as far as working out whether the plans are feasible, whether they're appropriate to the consumer groups that are going to the types of people that are going to be involved in the project, and whether the words are appropriate. So we're not asking the ethics committee necessarily to review the words if there's already been those people providing input into what the words are. There's quite a few other things in here that are a bit more technical. So I'll just skip on to the next one. So the final part of the checklist is to have a discussion about what the approach is going to be for things that get updated during the plan. So I mentioned earlier that there are some things that you might provide a template for. So it's having the committee make a decision about whether they're happy to just accept that the template is enough, or whether they're going to want to see every time that those things get sent out. So that might be the case if the study is a high-risk study, or if there's been a significant change during the course of the study, they might want to review everything as an amendment. So this is the sort of the scope of what this document is, and it's a draft. So we're very keen on getting feedback from people about what they think about this project. It's going to be part of the toolkit, which we're looking to launch early next year. So we're really keen on people downloading this document and letting us know what they think works or doesn't work to make this a really useful and robust guidance for people. So that's me.
Wonderful. So many, yeah, just a comment here in the chat saying so many wonderful points that you've just raised. And, you know, I had one quick question and then we might continue it in the chat for everyone too. It was, you know, do you have any examples of what might be a high risk communication that, you know, beyond a template that may warrant that, you know, needing that review?
If it's as high risk, if the nature of the research itself is high risk, then that's something that you might want to, you might say that every time that you're talking about this, you might want those reviewed. If the communication is along the lines of we've had to close the study because there's been lots of adverse events, for instance, that's definitely a high risk kind of communication that you'd want to make sure that the wording around that is appropriate.